We've really perfected early detection and prevention of breast cancer. We are trying to put the medical oncologists out of business.
For me, Dr. Elliott not only saved my life, she caught the lesions so early that not only did she affect the quantity of my life, but also the quality of my life. She caught it before the lesion was so big that I didn't need chemotherapy. It hadn't spread to another part of my body.
We don't want any of our patients to need chemotherapy. That's our goal. We're 98% there. We continue to get better.
This experience has taught me what early detection, what knowing, what the outcome can be, and it's positive.
They weren't just treating the cancer, they were treating me as a woman, and they wanted my life as a woman to be more what it had been before.
Breast cancer is a difficult journey, and anything that we can do to help women and make it easier, that's what we're here for. I wanted Montclair Breast Center to be my vision of how I would want to be treated as a patient. I've really focused on communication and time spent with the patient as really the cornerstones of what we have to offer.
I wanted to feel like I was coming somewhere where someone really cared about what happened to me. The Montclair Breast Center and the entire staff envelop you. They make you feel like you are the only patient they have, and clearly they have many.
I was never rushed through. I had enormous face time with the doctors. I spent time with the radiologist. She was explaining to me what she saw on my films. That never happened in any large facility.
That's priceless. You know, you walk out of it, you don't sit and wait for a letter to arrive saying, okay, you're all right. You have a relationship with the doctors. That for me is the big difference. And the area that we live in, which is super saturated with doctors, there's no reason for having anything but that kind of treatment.
We deserve to be treated in a way that is compassionate, that is caring, and you will always get that here.
Women research a lot of things that are important to them. They research where they get their hair done, what restaurant they should go to, and they really need to pay attention to who's reading their mammogram. Our radiologists only read breast images. They read mammograms, they read ultrasounds, they read breast MRIs, and do interventional breast procedures. Their level of expertise is really unsurpassed.
I think it's a mistake not to have a breast doctor. There are conditions that are so specific. Unless you're looking at breasts all the time, I think it would be very easy to miss things.
Women should have a breast doctor because breast cancer is the #1 killer of women in ages 40 to 55. Think of it this way, women go to a gynecologist every year, but if you add up all the GYN cancers together, uterine, ovarian, cervical, 1/3 the incidence of breast cancer.
I was coming from my yearly visit. Dr. Hertz was there, and she said, you know, I have a concern. What was so key for me, unsolicited, Dr. Hertz grabs my hand because she knows that now my anxiety level is going to be heightened. And it was with the breast MRI that they found that I did have the cancer. But it was because of the 3D mammography that they were able to detect it at all. And that's the key. The high technology is the key. I went in and Michael was here, and Dr. Hertz was here, and Maura was here, and they told me, and we were okay. I mean,
one of the feeling of being alone was not there, because every step of the way that I was here, they told us where we are, they told us what was immediately next, and they told us what was after that. And they were here with us for every step.
No question was too great. I could call them anytime. Dr. Hertz gave me her cell phone number. You call me anytime, whatever you need.
The anxiety level that you have when you're diagnosed, you can imagine, is tremendous. They take that anxiety level and just crush it because they're so good at telling and finding and explaining, from their surgeries to oncology to plastic surgery. I felt like I was on the dance floor and they were taking me from one person to the other, just carrying me through this. Yeah, it was incredible. I feel like it was easy for me. As easy as having cancer can be, they made it easy.
If you are high risk or suspect you're high risk, if you have a family history, if you have fears about going to your local facility, come here once. Try it once to see the difference.